question is on epidemiology. Let me just give you a brief background about it. Uh, so, see, according to me, I think it's a very important subject. Uh, in consulting, everything or maybe a lot of things depend upon patient numbers. When we are, forecasting, doing the forecasts for a molecule or, anything for a client or for the company's portfolio. So their patient numbers really matter a lot. And let me give you a very personal experience. Let me share my personal experience. So when I started with my job, my first project was related to epidemic. So I was given my boss. He didn't have an idea that I was new to the subject, to this consulting field. So he just handed over some project to me, and he said that I need the epidemiology of XYZ disease in so and so geography. And I was like, how do I, like, what is epidemiology? What do I need to find? Whether, are we looking for the annual number of cases, that is the incidence, or we're looking for prevalence? What is actually the difference between incidence and prevalence? From where to get these numbers? How to get these numbers? Which numbers are the most appropriate ones to be picked up or to be considered? Then should it be okay if I'm not getting numbers for this particular geography, which are the other numbers that I should be considering? I had no clue about all that. So at least according to me, epidem, or knowing, understanding the basics of epidem, what is incidence, what is prevalence, how do we calculate these numbers? Uh, like I was mentioning, that these numbers should be specific to a particular geography. Should it be, a case study, or should be a cohort study? Or if we do not have the numbers for a particular for a particular geography, then what are the other approximate numbers that we can consider? So knowing all these things is very important. So this is what we are going to discuss here. So it is actually a branch of medical science which investigates all the factors that determine the presence or absence of a disease or a disorder. And epidemiological research, it actually helps us in understanding, how many people have a disease or a disorder, and also if those numbers are changing, and how that particular disease or disorder, it affects our society and the overall economy. So it is often described as the basic science of public health. And it's also important from the perspective of, planning and evaluating strategies to prevent an illness. And it can also be used as a guide for the management of patients in whom this particular disease has already developed. So like clinical findings and pathology, epidemiology of a disease, it is an integral part of, its basic description, the description of a disease. It's very important. Uh, and, there are special techniques of data collection and interpretation, although we will not be going into that because it's a very, vast subject, and you need some specialization in that. But we'll have an overview of, what are the different technical terms related to epidemic. This is all what I can say. So basically, it is concerned with the distribution and determinants of health and disease, its morbidity, disability, injury, and death populations. The distribution, what is distribution? This basically implies that the diseases and other health outcomes, they just do not occur randomly in a population. How it is distributed. Who are the patients at risk? Who are most likely to get that disease or disorder? Then determinants, these are any factors that cause a change in a health condition and other defined characteristics. So for example, if a patient has this particular disease, he is more likely to develop. For example, if a patient is suffering from diabetes, he's very much likely to develop some kidney disease also. So these are the determinants. Morbidity is the illness due to a specific disease or health condition, and mortality is death due to a specific disease or health condition. Population at risk, sorry. Yeah. So population at risk, these can be, that population can be, humans, animals, plants. And this is a key feature of epidemiology. It's a measurement of disease outcomes in relation to population at risk. Which population is at risk of developing that disease. Okay. So the population at risk is the group of people. They can be healthy, they can be sick or ill, who would be counted as cases if they had the disease that is being studied. Clear? Any questions? And lastly, many epidemiological estimates try to determine how the number of people affected by a disorder changes over time. So, like there are different techniques and technologies that are coming into play now. So, for example, with time, the treatment modalities are changing, the diagnostic criteria or methods of diagnosis, these are also changing with time. So these have a direct impact on the patient population or the numbers, the epidemiology. So if the disease is, diagnosed at an early stage, so it is very likely that the patient can be treated and eventually cured. If the patient goes undiagnosed, then of course there will be a misdiagnosis, and that patient will not be included in the total patient pool. So that will also have an impact on the total patient number. So all these things, they impact the epidemiological estimates. And this is how the definition of a disease or a disorder, it usually changes over time. And therefore, it becomes really difficult to make an accurate estimate of the patient numbers. Okay.